Good morning, Facebook family. It's me, Danny. Unfortunately, I'm not doing a Facebook Live today because I'm busy working on a project that I have to be available for between the hours of 10 and 12. So I thought I would pre-record this presentation for you guys to go through shock and bleeding, like was promised on the schedule. And I'm using my newfound Zoom skills to be able to record this for you. And hopefully you'll be able to see the presentation in a minute. I have had a go, but you never know with tech. As you guys realise from the first couple of weeks, I'm just learning with this whole new tech thing. I normally stand up in front of people, which is my comfort zone. But hey, we've all got to get out of our comfort zone every now and again. So I'm just going to go and see if I can share with you the presentation. If you do like this way of sharing information, let me know. Just put it in the comments and I'll have a read. If not, and it doesn't work, then I'll have to change the times that we do the Facebook Live, and I will be demonstrating it again. Because we're dealing with shock and bleeding, it is actually quite difficult to get people to help out with that in terms of showing me and you guys. I don't want to make my kids bleed, all right, just for the love of it, to show you what to do. So hopefully this will work. So let's have a look. Just bear with me because I will try and see if I can share. So you might see me making weird faces while I do it, but otherwise hopefully you guys have got that from now. And I'll get rid of this little thing. There we go. So let's have a look then. To go backwards. Right, so bleeding and shock. So what we've got here then is basically small wounds, which you guys deal with normally on a day-to-day basis if you've got little ones especially, and larger wounds that you may have to deal with if you're in the house with an older person who may have got themselves into a little bit more trouble. And actually the easiest way to think about this is the blood loss is effectively a problem with infection or severe blood loss, which is potential loss of life. So the smaller the wound, the bigger risk of infection. However, the larger wound, the bigger risk of loss of life. And so let's start off with Hermione there when she was little, demonstrating a fantastic nosebleed. As you can see, it doesn't go all the way into the nose because it's fake blood. So we're demonstrating that she's got a nosebleed here. So easy to treat and yet so often mismanaged. It is so easy to deal with a nosebleed normally, it's ridiculous. However, people don't seem to realise that actually the treatment is in well, the end result is in the treatment. So pinch the nose at the soft bit. And I've had rows with people about this. Well, you've got to pinch it below the hard bit. Yes, that's the soft bit, which is effectively pinching the nostrils closed. And this means that the blood starts to clot, which is fantastic. And it takes about 10 minutes for this to take place. When you've done your first 10 minutes, and I'm not saying it's easy to try and get a child to stay still for 10 minutes, but that's the treatment. Check if it's okay. And if it's still bleeding, then you pinch and wait for another 10 minutes, and then if it's still bleeding again, then another 10 minutes. If it's still bleeding after a maximum of 30 minutes of appropriate treatment, then you need to seek medical attention. That might not necessarily mean an ambulance or hospital, but you could ring NHS Direct, let them know what's happening, and they will be able to advise you further. So nosebleeds, 30 minutes of appropriate treatment, and you'll probably be able to get that nosebleed to stop. And bearing in mind, this is standard treatment. This does not mean that if anybody's got a pre-existing medical condition where their blood doesn't clot or anything else, then that's the same. No, it isn't. You need to then follow an appropriate care plan. So we've got now next then bleeding, but how did it happen? That question is really important because it tells you what to do as a result in terms of the treatment. So here we've got two cuts. On the left-hand side, you can see there's a cut to the finger. This was probably done by a sharp object, and there is no dirt in it. So the treatment for that will be coming up. But then on the other side, you've got a graze to the knees. This is Hermione's knees, which took place at school, where there's lots of dirt in there. If you remember what I said a couple of minutes ago, that one is going to have a serious problem or potential for infection, and so you've got to be really careful with that one. So bleeding, how did it happen? What we call the mechanics of injury in first aid, because that goes on then to inform you how to treat it and what to think about. So therefore you've got the treatment here. On the left hand side there, you've got some water. Just plain water out of the tap is absolutely fine. You do not need to be applying any antiseptics or TCP or anything like that. Gosh, I remember TCP. Oh, the smell of it and the trauma. It's horrible. That stingy, horrible pain that you get when your parent used to clean your wounds out with some harsh detergent or antiseptic. So no, you don't need it. Just plain water out the tap that you would drink. You can use that to clean that wound. That finger one would be great. Just run the finger underneath the cold tap or the warm tap, and then you would apply a plaster. However, that picture, if we go back to the right hand side, this one here needs an awful lot more treatment, and it's gonna hurt, unfortunately. So what we would do is place that limb underneath that tap or that fast flow of water, if we could, and then we would use a gauze, okay, and that gauze we could then clean the area using a gauze or a pad, excuse me, at home if you have one, just to clean out the wound. It is so important that you clean it. And I know this is going to sound a bit weird, right? So please bear with me. But please do it while the child or the person is crying, actually, if it's a grown up. And it's that great, it really shouldn't be crying. But hey, you know, tears are all right. But if they are crying, try and get it cleaned whilst they're trying. The worst thing in the world is to try and calm a child down and then go and apply some kind of treatment, which makes them cry all over again. So whilst they're crying, get them to that tap as quickly as you can, and then rub that area briskly and thoroughly to get all of the dirt out, because you do not want any of that dirt stuck in that wound. Whenever I'm delivering first aid training to schools and other care settings, it is so important that that person uses some gloves, obviously, and also it is really important that we use the appropriate dressing. So this plaster here on that knee is not going to cut the mustard, all right? It's just not. So what we need then, I always tell them to get these really big melon dressings, huge, massive dressings, which are sticky on all sides, but are massive. So you can put them on knees and on elbows. They are fantastic. But remember, the treatment needs to be delivered first. We should never, ever put a plaster on a wound which is full of potential infection. All right, so make sure that area is clean. All right, this was the nicest picture I could get from a free download on the internet. Do not type in severe blood loss to the internet before you have had your breakfast, or after, actually, for that matter, because I was, yeah, it was quite nasty. But this was the nicest picture of blood I could get. Well, we're talking severe blood loss, all right? So the other ones were small blood loss, infection. This one's severe blood loss, which means that losing a third or more of that blood from your body will start to make your organs shut down. And this is as a result to try and preserve the blood flow to the vital organs. If not successful with interventions, then loss of life will occur. So this is where people who are stabbed or who have lost limbs or who have had a severe injury lose their life because they've lost blood. Their body goes into hypovolemic shock, which effectively means low blood volume. So actually, the first thing we need to do, so important, treat the cause of that injury. Treat the cause. So that's to stop the blood flow from coming out, okay? You can go into shock for a number of reasons, but today we're focusing on blood. So therefore, stop the blood from coming out by applying pressure to that injury and just putting whatever you can get on it. So if that's a tea towel, a dirty cloth, I don't care, whatever you've got to hand and somebody's bleeding out, you need to put that on the injury and push with all your might while screaming at the top of your lungs for somebody to get help. And we need help in the form of an ambulance, emergency intervention right now. But what we can do whilst we're at home in terms of first aid is to lie that casualty down and elevate their legs, get their legs up, because what that means is that all the blood from their legs go back to the brain, the heart and the lungs, which tricks the brain into believing that it does not need to shut down those organs because it is being fed a constant blood supply. So the treatment position is always so important. Make sure you've got the casualty lying down with their legs elevated, okay? Keep the casualty nice and warm. They will start to feel cold. Their body will start to be clammy, so they get like a sheen of sweat over their head. They might feel nauseous. Don't give them anything to eat or drink, okay? Keep them nice and calm, and then loosen any tight clothing. And as I said here before, it is call 999 or 112 for emergency intervention and tell them there's severe blood loss whilst you are pushing down on that injury to try and stem the flow of blood, okay? With enough force and with enough pressure, you could get the blood flow to stop. So it's really important that you treat the cause first. Okay, so that is the end of our presentation. So hopefully, if I can get this to work now, I'll be able to get you guys back. No, it's not that one. We don't change. Hi, there you go. Thank you. So hopefully that went some way into explaining the importance of how to treat a bleed and consequently how to treat a severe blood loss injury where shock could occur. And whilst you're at home, it's also really important to remember that injuries do happen at home, and first aid can be the difference between that person going off to hospital and staying at home with effective treatment. So check your first aid kits, make sure you've got enough plasters, make sure that you've got enough dressings, and remember everything I've talked to you about today, and you guys should be fine. So next week, the schedule is available up on Facebook, so please let us know whether or not you'd like to add to anything to that. But otherwise, have the most amazing day. Thank you very much for bearing with me while we're looking at all of this new tech. And I hope it's been informative. But otherwise, stay safe and stay indoors. Take care. Bye.